Hey guys, today I am going to narrate sort of a PowerPoint on the medical abbreviations that you need to know, and we will see how this goes. I can't imagine this is going to be an extremely exciting video, but that's what we're going to do. And just so you guys know, I've been sick for a week. And so this is just what you're going to get today, okay? Raspy voice, hair in a bun, no makeup. That's the way it's going to go. But let's go. Let's go into this video so that you guys can listen to this and prepare to know what medical abbreviations mean. Okay, let's just read through these slides. So AKA, what does AKA mean? Okay, so it is above the knee amputation or alcoholic ketoacidosis, but that's like way down the line. I'd go with above the knee amputation if you were asked that on like a submodule type of quiz. ADL, what is ADL? ADL is one you will hear all of the time. This is activities of daily living. So this is things that we do for our personal care. This is what we kind of talk about when we're talking about helping our patients with activities of daily living. So like getting them dressed and having them brush their teeth and just eating and cutting up, their food. So that's activities of daily living. AMA. This is against medical advice. This is when the patient chooses to leave the hospital before the physician has recommended they can leave. So if we want to go a little bit further onto this, people sign out AMA. They leave AMA. This means that the doctor did not say that they were cleared to go then, or if they're actually just leaving AMA, you have to get them to sign a piece of paper if possible, stating that they understand the risks of leaving against medical advice. And then also is what that means for their insurance is it means that if something should happen to them, when they leave the hospital, the insurance is no longer, maybe going to cover them, maybe. Okay. PRN. So what does PRN mean? This one you are going to hear all the time for many different orders and reasons. So it's the Latin phrase pro renata, translated to as needed. So this kind of is a term that you'll hear for drugs like give Tylenol, PRN for pain. So that just means as needed for pain. BRP, know what that one means? It's bathroom privileges. So if you have something on your patient's activity level for their orders, sorry, my dog has to go into her bed underneath my desk. Bathroom privileges. So that will be like an activity order. So maybe they're on bed rest, but they have BRP, they can go to the bathroom. BR, like I just said, bed rest. So that is an activity order. AC, before meals, often used to describe when medications should be taken. So you'll see like a medication order that says, a certain drug and the time will be AC, which means to be given before they eat. PC is after meals. HS is hour of sleep. So this is a bedtime dose. BM, bowel movement. CA, so CA has a lot of meanings. Capital C and a capital A to me means cancer, but it can also mean calcium or cardiac arrest. CO2, carbon dioxide. CSF, cerebral spinal fluid. So this is the fluid that surrounds your brain and spinal cord. It's a layer of protection, kind of keeps the brain and spinal cord buoyant. C/O. So this is complains of. So chief complaint of, complains of. CBC, this is a blood test. Complete blood count. This looks at all of like your red blood cells, your white blood cells. CAT, Computerized axonal tomography. So this is an X-ray which a computer generates a cross-section of the patient's anatomy. CCU or CVICU, coronary care unit or critical care unit. MICU, the medical intensive care unit. SICU, surgical ICU intensive care unit. The ED is the emergency department. The PACU is the post anesthesia care unit. So that's where people come out of surgery. So that is the unit where people recover from being under anesthesia. That's the PACU. There's tele. Tele is the telemetry unit. That means that the patients are on a cardiac monitor. So they're on a device that watches their cardiac rhythm, their heart rate. IR is interventional radiology. So originally, IR was a subspecialty where there was invasive procedures for patients done in a radiology type of setting. IR is now a therapeutic and diagnostic specialty that comprises a wide range of minimally invasive procedures, both therapeutic and diagnostic. Okay, these are going to be some IV fluids that we'll talk about next. We have D5NS. So that's dextrose 5% in normal saline. So this is IV fluids that can be administered to our patients. DX is diagnosis. So that's the shorthand for the word diagnosis. RX, that's prescription. So I have in small print here, the symbol RX is usually said to stand for the Latin word recipe, meaning to take. Okay, D/C is discharge or discontinue. ECG is electrocardiogram. It used to be actually EKG, but it's spelled with a C, so it is ECG. But you'll hear a lot of professors probably still calling it EKG. This is a different ED. This is erectile dysfunction. We have LOC and ALOC. So when you say these, you say them as LOC or ALOC, not ALOC and not lock. So this is level of consciousness and altered level of consciousness. The K with the plus sign is the symbol for the electrolyte potassium. LB is a pound of measurement, the pound. KG is kilograms. This is what we use in the hospital setting for our measurement of weight when we are dosing drugs. We base it on kilograms. And you'll have to know that for math one of these days. So a kilogram is 1 pound is 2.2 kilograms. So here are the drug schedule abbreviations. BID is 2 times a day. TID is 3 times a day. QID is 4 times a day, and QD is once a day, but you can also see that ordered as daily. LP is lumbar puncture. Here are the symbols for male and female. If you're just writing something with, shorthand and you write it like this, then it's sort of internationally known that that is male versus female. I looked up what it would be if there was other sort of qualifications for the gender. And so the combined male-female symbol you see there is used to represent androgyny or transgender people. And when additionally combined with the female and male symbols, it indicates gender inclusivity, though it's also used as a transgender symbol. GI and GU, this is gastrointestinal and genourinary. FX is fracture. And I think that might be it because I repeated CBC, complete blood count. Is what I would really like is, although then you see me big on the screen and that's just not okay right now. But if you want me to make some videos on medical terminology, I could do it kind of like this. Or I could do it just sort of sitting on my couch going through the notes. Let me know which way you would like. Okay. And I will continue to make these for you guys. Okay. Bye bye.